Okay, we're gonna get started. So we're all here for the Honors Bachelor of Healthcare Technology Management webinar. It's the second webinar we're hosting this summer out of 3. And each month this summer we're being joined by an industry partner to talk about the jobs in the industry for healthcare technology management. Getting right into it. So here at Durham College, we have our Honors Bachelor of Healthcare Technology Management. It's our first degree and our brand new degree. It's the first of its kind in Canada. Students in this program will gain a comprehensive expertise in medical technologies, life sciences, and business practices that employers are demanding. So joining us tonight is Program Coordinator Rick Tidman. Rick Tidman is a professor with the School of Science and Engineering Technology and a program coordinator for the Honors Bachelor of Healthcare Technology Management. With over 35 years of experience in the healthcare technology field, Tidman has been the driving force in the creation of the HCTM program, first of its kind in Canada. It is from his experience and wealth of in-depth knowledge that allowed Tidman to understand the rapidly changing healthcare technology field and the gaps that exist. Also joining us tonight is Iris Coe. Iris, MBA, is currently a professor at Georgian College and an adjunct faculty at Odette School of Business, University of Windsor. Ms. Coe acts as an advisor for the Kingston Health Sciences Center on their Innovation Partnership Project. Ms. Coe was a member of Durham College's original HCTM Program Advisory Committee, which helped with the development of the program, provided by her wealth of experience and expertise. She was the Strategic Policy and Innovation Director at the Ontario Public Services, and in this role, Ms. Coe led the development of the broader Public Sector Procurement Directive and the Innovation Procurement Strategy for Ontario to incentivize innovation development and adoption. She established funding programs to accelerate the cultural shift to value-based procurement, which was recognized by the Ontario Health Innovation Council. Ms. Coe will speak later in this presentation about her experiences and about healthcare technology management as an industry. Getting right into it, this webinar is going to go using a question and answer format. So I'm going to ask Rick a couple questions about our program, and he's going to provide some feedback and answer some of the questions. So first question is, what is healthcare technology management? Rick, if you'd like to answer.
Sure, be happy to. So can you guys hear me okay?
We're good.
Okay, so healthcare technology management is a new and emerging professional that has the interdisciplinary skills to manage a transformation that's currently underway within healthcare, where technologies are changing just about every aspect of healthcare, whether it's in diagnosis, therapy, monitor, or treatment, or professional skills that the staff need to know, whether it's related to health outcomes. Almost everything that's changing in healthcare has to do with technology, and our current crop of professionals, whether administrators or clinical people or some other traditional expertise or expert, does not have those interdisciplinary skills that our new healthcare technology manager will have to manage the transformation that's underway and will accelerate. So it's a brand new profession, and it's the product of technology moving in and changing healthcare in an unprecedented way and at a speed that I don't think anybody could have anticipated in the years up to now. But it's here and it's coming and it's accelerating. And I think our new program and our healthcare technology manager is a person with the skills to manage the transformation. So, Sam, back to you. Sam?
Yeah, sorry. Thanks for that, Rick. So our next question, trying to figure out technology, will be, what is a college degree? So I'm actually going to take this one. So a college degree, Ontario colleges began offering college degrees in 2002 to provide a unique option for students looking to integrate theory with intensive applied learning. Degrees offered by colleges provide students with career-focused education that combines the best of both the theoretical knowledge and the analytical skills traditionally associated with a university education and the applied skills acquired through college education. Students graduate with the comprehensive theory and practical experience required by employers in today's competitive and quickly evolving workforce. Students will also have the opportunity to put theory into practice in courses of their studies, gain work experience and hands-on training before graduating. This college degree was developed with that particular goal in mind. So students in this program are going to get more hands-on experience than you would in a traditional university degree. They will be working with the healthcare technology in their classes all the time. There will be labs, there will be in-person research opportunities, things along those lines, as well as getting your theoretical knowledge and understanding the theory behind a lot of your practices. You'll take business courses, you'll take communications courses. It's really interdisciplinary, and that way when you're going off to graduate and you're ready to apply to jobs, you will have those skills and you'll already have that experience to apply to these jobs. These degrees are equivalent to university degrees. They are 4-year, 120 credit honors bachelor's degrees that have been quality assured by the Post-Secondary Education Quality Assessment Board, and after being referred by Ontario's Minister of Advanced Education and Skills Development. So the Ontario government has already vetted this program as well. So rest assured, it's the exact same as a university degree. You're just getting a little more practical hands-on skills as well in this degree. So moving on to question number 3, what will a typical first year look like? Rick, are you able to take this one?
Sure. So I think the first year post-graduation will be similar to a lot of professions where you have to start at the bottom, you have to learn the ropes. And in a hospital, you'll probably start doing preventative maintenance and answering questions from the clinical staff across the organization. So you might get to work on a Monday morning, and the first thing you are at 10 after 8, you're up in ICU. By 9, you're in the OR. By 11, you're in a boardroom explaining something about new and innovative technology. So there are no areas within a hospital that will be off limits to you. But I think in this first year, or the first couple of years at least anyhow, will be, the kind of the basic level set of responsibilities where you really learn all of the different areas within the hospital. You really learn about all the clinical procedures. Well, to some extent, you'll learn about the nuances of the people, and you become very familiar with making your way around the organization and the type of patients and the type of personalities you'll encounter in the different areas. So I think that's what you can expect for the first couple of years anyhow. Sam?
Thank you, Rick. So our next question are, what are the notable features of this program?
So is that for me again, Sam?
Yeah, it is.
Okay. So I think one of the key features of this program, we will have all of our curriculum and our theory tied to the technology and tied to the application. So throughout the 4 years, you're going to get a balance to theory and how the theory is applied to what your career is intended to do. So on day 1, post-graduation, you'll have a skill set that will make you valuable to an organization. Even though I just said you will still have to start at the bottom, you'll have skills that are considered valuable and that will get you into healthcare, will lead you into that first job. And I think that's a really unique characteristics of an applied degree, is that you have those requisite skills to get hired. And once you're hired, you can kind of plot your track where you want to go, whether you want to work within a hospital, or where you want to work in the private sector or for government. It all depends, but you'll exit school with a basket of knowledge that makes you valuable to the organization and should get you hired. Go ahead, Sam.
So we have some pictures here. So these are examples of experiential learning you'll have during the degree. Rick, do you want to explain them a little more?
Sure. This is a 3-year project, research project, that you could participate in because we do have students from UOIT in it as well, from engineering. So it's open to anybody in biomedical and the life sciences. And this is where we printed that head that you see there. That's a geriatric head. So we printed the head in recognition that geriatric patients are the highest expense to healthcare. So most of the health needs are accrued from geriatric people. So we took that headset there that you can see on our head, and we took a 3D camera, took some pictures of our students' ears, set them to our 3D printer. Then it's a little bit confusing, but we printed the inverse mold, meaning that all of the space within your ear we printed, so you could kind of think of something plugging into your ear perfectly. And within that, we embedded some sensors. So the sensors and the inverse mold are within that headset, and they can pop onto a geriatric patient that's device specific for a certain person. So it fits perfectly. And we have some non-contact sensors that we can pick up 5 vital signs. And on the top of that headset, you can see well, it's kind of hard to see, but if there is a microprocessor with Bluetooth capability that we can Wi-Fi it out to a user interface, and we have real-time communication between our geriatric patient and a primary care physician or a monitoring physician in real time, regardless of location. So our patient can resume their normal daily activities, travel anywhere in the world. As long as they have Wi-Fi, they can pop these on at some kind of scheduled time, and the clinician can look at any kind of vital sign they want. Maybe they can recommend certain medications, or provide some other kind of advice, but it's a real-time communication so that our patient can resume their daily life. They don't have to worry about straying far from home, and they don't have to worry about not being able to be monitored. So we will have research projects that are similar in the degree, but more at a strategic level, so more at a higher level thinking. So maybe we'll have a project where we look into a combination of technologies, and the technologies, when used in a certain way, lead to better health outcomes. So I think within the HCTM, some of our long-term research projects will be more to strategic at a hospital or a LIN, or maybe even a provincial level, but we'll take all kinds of data from technology and we'll figure out how synergies are available to us, and we can make recommendations in research and how technology will lead to better health outcomes. So our HCTM program has a wider perspective. Okay, Sam?
Thanks, Rick. And then on the next slide, there are some more images of notable features. So in this slide, there are some pictures of our global classroom, not in its current state. So you'll see the picture of the global classroom at the top, and then you'll see our brand new building, the Center for Collaborative Education. So the global classroom will be moving into our new building. It is a state-of-the-art classroom now. There are computer screens all along the one wall. That way you're able to interact with students all around the world. So they are able to log in, and they'll be in real time. They can raise their hand and the prof can call on them at the same time. So that's kind of a really cool, notable feature. Rick, do you want to explain a little bit how you'll be using the global classroom within the degree?
Sure. So the long-term vision for the program is to be able to deliver the curriculum, I think maybe around year 5 or so, but to deliver the curriculum in a global environment, in recognition of the World Health Organization identifying the access to technology as the #1 cause of low health outcomes. Or it's not access to clinical professionals in low resource settings, it's lack of resources around technology and the lack of technology itself to be working. So I think our HCTM program delivered globally, and especially to new learners in low resource settings, offers one of the most wonderful opportunities to improve health outcomes in those settings. And we can do that in a global classroom because it has the technology, the information and communications technologies, where we can start to build on AI or augmented reality or virtual reality. We can take advantage of all the new technologies to bring global learners, regardless of location, into our classroom in a fully immersive environment. So they won't know that they are not in the classroom with you, and you'll be able to communicate with them in real time. They can join group activities. I just think it's going to be just a fantastic opportunity to give learners anywhere in the world who don't have the resources to come to Canada, or to leave home, a way to develop skills and the knowledge to change their local community in just a phenomenal way they'd never be able to otherwise. Okay, Sam.
Yep, and then final picture on this slide is the AI Hub. So it's brand new to Durham College. It just started this past year. So it's a great resource for students who will be in the degree who are interested in working within the artificial intelligence. As we know, the point of singularity is coming up, and it'll be something that will impact the careers of healthcare technology management students and graduates. So it's nice having that resource, this innovative state-of-the-art hub here at Durham College. Moving forward, so our next slide is what will my career be like with this degree? So if we just backtrack a little, I saw we have a question. So our question asks, does your grades in school get you to work in the top department at the hospital? So maybe when you're talking about careers here, Rick, are you able to discuss how you'll get those careers and how your grades might impact your positions that you'll end up obtaining when you're out there working?
Sure. I think grades are very important. They'll be certainly evaluated when you graduate, maybe by your first employer. They'll look at everything you've done in school relative to the other students. But I think healthcare, like a lot of professions, advancement in careers will be more dependent on deliverables. So what you deliver and how well you do your job will be recognized by the hierarchy of the people above you. If you can make them look good and if you can do your job well, opportunity is almost limitless in healthcare, especially in your careers in healthcare technology management, because there's no limit to technology. So grades are important for sure early on in your career, but as you advance in your career, it's going to be based more on outcomes and deliverables and how well you can do your job. Hey, Sam.
And then can you provide us a little more information about what careers will be like in this degree? I know you've touched a little bit on your entry-level positions, but will students or graduates from this program, will they be working a 9 to 5? Will there be travel? What are you picturing their careers to look like when they graduate from this program?
Sure. So there are going to be a number of opportunities for you. You'll have to decide where, at some point early on in your career, where you would like to work, whether it's in regulatory, the public sector, private sector, maybe as an independent expert or a consultant. But depending on where you are, if you're, we'll say that you start off in the first 5 years of your career, you're working as a biomedical engineer in the hospital, then you are advanced to the manager of the department. So now you're the healthcare technology manager for the biomedical engineering department. In that role, you will have a lot of responsibility. So you can be expected to be available whenever there is a crisis, whenever there are, big decisions to be made. At that level, it's not probably like all executive levels. It's no longer 9 to 5. You're in a functional specialty, and you're dependent on, um, and you probably hopefully love it and don't find that it's work when you can contribute in a meaningful way and find a ton of satisfaction from it. But at that level, like any kind of executive level, there's a lot of work, and sometimes work falls out of the normal hours. But I think for those first few years, you would normally work, 8 to 4 or 9 to 5, and maybe do some kind of rotation on the weekends or something. In the private sector, depending on where the installed base is for your company, you might have a territory, Southern Ontario, or maybe all of Ontario, maybe all of North America. So maybe Wednesdays you fly to Texas and Mondays you fly somewhere else. So it all depends which area of healthcare technology you want to go into. But I think as you move up in the hierarchy, which you all are planning to do by going into this program, you will be in the C suite at some point in your careers, and a lot of activity goes on in the evenings. And like I say, hopefully you just love it so much that it doesn't really feel as much like work. Sam? Sam?
Sorry, I forgot to turn my mic back on for those in the Adobe chat. So I just saw that we have one more question, so I'm just going to address that before we move on. So as a new graduate, will there be opportunities to be hired at an entry-level position with little or no experience? Just because we know that usually employers want experience. So Rick, can you kind of talk to that a little bit more?
Yes, for sure. Part of the program, part of the HCTM program and the BMTY program is to make you career ready. So it is built into the program that you will exit the program with enough and requisite skills to get you hired at an entry level position. There shouldn't be anything you need beyond the degree to get you that first job. Uh, what did you say? New graduate opportunities. So of course it would be like all degrees anywhere. You'll start, at the entry level, and how well you do your job is how quickly you'll move up in the hierarchy. but we do provide you with all the skills and the placement opportunities to get that first job. So.
Thank you, Rick. So our next slide, so Iris Coe. Iris Coe, MBA, as I introduced her earlier, she has a background working in Strategic Policy and Innovation Director at the Ontario Public Services. In this role, she led the development of the broader public sector procurement directive and the innovation procurement strategy for Ontario to incentivize innovation development and adaptation. She established funding programs to accelerate the cultural shift to value-based procurement, which was recognized by the Ontario Health Innovation Council. As also I mentioned, Ms. Coe was a member of our original Healthcare Technology Management Program Advisory Committee, providing guidance and expertise in the development of our degree. And if you watch the video that's on our Bachelor of Healthcare Technology Management website, on the Durham College website, you'll see that Ms. Coe actually speaks during that part. So, Ms. Coe, if you'd like to join us now and talk a little bit about your career and things like that.
Sure.
So, first question is, how does your career interact with healthcare technology management?
Okay, thanks, Sam. Is it clear? You can hear?
Yep, we're all good.
Okay. So I guess over a decade, while I was a director with the Ontario province, I led a team in facilitating healthcare institutions to do business transformation. So healthcare technology management is part of that advancement. Equipment is needed for diagnosis or safe treatment of patients. So effective and efficient management of health technology will improve the efficiencies and quality of healthcare services. There is a need for management of health technology because it will impact the health system's capacity to adequately respond to healthcare needs and expectations and increase health outcomes cost effectively. Now, the value of healthcare technology management is beyond technology. That's why we feel there's a need of this program. As part of my former role, I interacted with healthcare providers, policymakers, academics, and health technology companies to develop healthcare innovation strategies. One thing that is obvious, healthcare becomes more complex over the years, and we need to provide health solutions in a more holistic and integrated approach within limited resources. Integrating expertise across disciplines and sectors will allow innovative and groundbreaking solutions to happen. So give you an example is my team advocated something called innovation procurement. The key features of these type of procurement models are articulating the problem to be addressed to the industry instead of detailed requirements, and then engagement of all users, like be it patients, clinicians, academics, the industry to develop these technology. When a health organization articulate their procurement needs in terms of problem to be addressed and the outcome they want to achieve, it will allow the industry to develop innovative technology to meet the needs, instead of having the health organizations attempting to determine where an innovative technology fits into the procurement organization's clinical process. Let me give you a simple example. What I mean is that, we all buy pens sometime, right? And we can say that I need a pen that writes smoothly, fits my hand, whatever. But if we want to incent innovation, how we articulate the problem is that we want to say what I want to achieve. So we'll say, I need an apparatus operate by my hand to transfer my thoughts onto a piece of paper. Now that definitely fits a pen, but it opens up for any innovation and technology that comes in. Why we're doing that is because we need innovative health technology to provide better health outcomes. And by involving patients, health providers, and a lot of different people, we can now make sure the considerations are given upfront for any specific drivers for adoption for that type of technology. So with this types of work, I have more appreciation of the diverse need of healthcare technology management. Thanks, Sam. Okay.
Thanks, Iris. Moving on to our next question. In your opinion, what is a valuable piece of knowledge or skill that the Bachelor of Healthcare Technology Management grad should know? This doesn't have to be career specific, not like a tidbit about technology, but just a general skill that you think that they should know going into this career.
Okay. Well, it's difficult to narrow down to one or two technology knowledge or skills, but because healthcare technology management is becoming more complex, and we need experts who can look at a piece of equipment and ask, how does it work? For whom it should be used? Is it safe? Is it effective? Is it better than what we already have? Given healthcare funded with public dollars, we also need to ask, does it provide value for money or worthy to be invested? Now, these decisions are beyond technical knowledge of existing technology. It is a field that requires the involvement of staff from many disciplines because they actually will deal with the healthcare technology in different part of the process. So we will need professionals who grow in their knowledge of the health system, health policies, technology, economics. But more important, we also need them to establish broad skills such as management, problem solve, communication. I would say it's not enough to think about will I get a job when I graduate, but also think about how you can stay in the leading edge when you turn 40. If I am forced to prioritize the skills and learning, I would say having independent and critical thinking, a continuous learning attitude, and strong communication skills are also very important.
Thanks for that. That's a great piece of advice there, that we need to consider not just the current, but also what's going to happen 10 to 15 or 20 years from now when we are 40 and we have to think about our careers at that point. It also leads really nice into our next question. How do you see this industry changing in the next 10 years? So we've talked about your career previously with the Ontario Public Service. And in that position, you were doing a lot about procurement and creating new procurement methods. So between yourself, and if Rick wants to actually comment on this as well, how do you see this industry of healthcare technology management changing in the next 10 years? Also keeping in mind things like artificial intelligence and the point of singularity.
Okay. Okay, let me start by saying we usually say change is the only constant. But instead of worrying about change, we actually now need to worry about the pace of change is actually faster than ever. That's why I said earlier we need people who are open-minded, have critical thinking, because then they are ready to handle constant changes. It's not just building the foundation of technical knowledge, but that continuous learning attitude to manage these change. Now, having said that, there is definitely in the last few years why I work closely with Ministry of Health and the health priorities, and I continue to work with a lot of health institutions. I notice there is a increasing focus on digital health, remote patient monitoring, and self-management. That means we're moving from acute health settings such as hospitals to the community care. Now, with the growth of AI and remote patient monitoring, it means there's going to be an increase of the reliance of data analytics, integrations of technology with software component to improve the delivery of healthcare services. Now, we all know about Fitbit. Maybe some of you are already wearing that on your hand. There will be a lot of new apps, wearables on the market, and more innovative ways to enable self-management. The importance, though, is how are we going to connect these data to the healthcare providers like family doc and specialists and health institutions to utilize these data to help us. So with limited investment, the value of health technology assessment will also be increased. Like the type of questions I asked you, to think about, is it worthwhile to invest? We need to understand that a lot more. And I also mentioned the innovation procurement concept. There's a need to support these innovation procurement process to develop outcome measures because it is difficult. It's easy to measure whether the pen works. It's hard to measure an apparatus that can transfer your thoughts onto a piece of paper, right? So I do see a role for health technology management graduates to be involved and later on leading this type of innovation projects because they will be trained in a comprehensive way and be able to communicate with people with different discipline background, like clinicians, technology developers, administrators. So I think there is just lots and lots of opportunity, lots and lots of
Thank you. Rick, do
exciting
you want to also
opportunities
comment on
going
this?
to come.
Sure. I think maybe from a higher level, from an overarching perspective in the next 10 years, technologies will provide real-time analytics, predictive analytics, and will also provide prescriptive solutions to healthcare problems. And all of that is done through AI embedded technology, almost independent of the clinical professionals who are currently in healthcare right now. So I think Sam had mentioned earlier about that point of singularity, whether that's 2025 or somewhere around there, that's when AI has the similar or more advanced analytical capacity of the human brain. So you could kind of, if you could crystal ball it, you can kind of see the shift underway, but it'll accelerate so that the technology will lead all of the change in healthcare. And it will be, if you are the manager of the technology and technology is leading healthcare, it's very likely you will lead the organization, maybe not within 10 years, but certainly within your careers, because the number one desire of all of healthcare is to have better health outcomes. And if the technology allows the individual to take control of their health condition, and it's all driven by technology, then your potential within the organization is almost unlimited if you could kind of look 10 plus years out beyond singularity. Sam?
Thanks, Rick. So our final question for Ms. Ko. So as I mentioned earlier, Ms. Ko was featured on the Bachelor of Healthcare Technology Management promotional video found on the Bachelor of Healthcare Technology Management website on the Durham College website. So if you have perused our program information pages before, you'll find the Healthcare Technology Management one. In this video, Ms. Ko mentions that how there is a need now to understand healthcare technology in a more holistic view that is not just technology but other aspects. So she's already elaborated on before, but we just want her, or I was wondering if you would be able to talk in just a concise manner about how it is required to have a more holistic view, understanding the other aspects that are required in this career.
Sure. As mentioned before, besides managing the operations aspect of the health technology, we also need to understand the health policy, the standards, economic impact, risk impact. For instance, besides conducting health technology assessment for adoption purposes, also look at the management of technology in the health system for appropriateness and timing of replacement. For effective operations, we need to have the appropriate people, process, and technology. So that's the reason why we need to train professionals, not just know how to use and maintain the technology, but also manage the process from planning, assessing the appropriateness and economic impacts, to acquiring, operating this technology, and replacing them with new technology. Now, most of us replace cell phones very frequently, but it's interesting. Sometimes we don't know when we should replace the equipment in the health system. I also was invited to speak at national and international conferences in Canada, Asia, and South Africa in the last few years. I can tell you that this is a trend and will stay, and it's a hot topic everywhere about technology management.
Thank you. Is there any final words that you want to say, Iris, about the Healthcare Technology Management program?
As the health systems are transforming around the world, the importance of educating the next generation's health-related professionals to meet the changing needs for effective health service delivery are top priority. We really need these resources today, to be honest. The skill sets that anybody will be taking this program and learn from the program are important. Not just working within the health service delivery institutions like health hospitals, but also within the ministry for policymakers and the suppliers community. So good luck.
Thank you. So just some final parts here before we have a question period. So admissions into the program. For getting into the Honors Bachelor of Healthcare Technology Management program, we require an Ontario Secondary School Diploma or mature student status, so you're 19 years of age or older, including 6th grade 12 university or M-level courses with a combined minimum average of 65%, including grade 12 university English, grade 12 university math or grade 11 university math with a minimum of 70%, and grade 11 or grade 12 university biology with a minimum of 60%. If you've already gone on to post-secondary, you've gone to college, you've gone to university, we will take post-secondary credits instead. So we require 6 post-secondary credits with a minimum combined average of 65%, including college or university English or communications, college or university math, and college or university biology with a minimum of 60%. We recommend students who are applying to this program to have a grade 12 university physics or grade 12 university chemistry. However, it's not required. They're just recommended that you have that. And then financial aid and awards. So how are you going to pay for school is another really big question. So there's a couple of different things that I just want to point out on this slide. So we have our entrance award. So all qualified applicants who successfully register in their courses for the Honors Bachelor of Healthcare Technology Management program will receive $2,500. It'll be deposited into your student account, so you'll never see that money, but you'll still end up having that taken off your student account. Other resources that are available, there are bursaries and awards here at Durham College. Once you've been accepted, you're able to fill out your financial aid profile on our My Campus login, so it's our internal system, and that way you can apply to bursaries and awards. We also highly encourage students apply to OSAP. You may receive more money than you would assume you would under the new program. There are tons of grants available out there, and grants are free money. And then we also have on-campus employment opportunities, including DC Works and summer employment. There are opportunities to already work kind of in your field. I know in the 3-year biomedical engineering technology program, they have a summer student. So there are those opportunities out there to start working while you're in school. In addition to that, we forgot to really talk about it a lot earlier, but we have our field placement in this program. So you're going to get hands-on experience during your field placement. You'll be gaining that experience that's required when you apply for a job to be able to talk about what you did while you did your field placement. On this slide, however, so financial aid can be reached at financialaid@durhamcollege.ca, and they're also located on both the Oshawa and Whitby campus. But if you'll be coming for this degree, you'll want to come to the Oshawa campus, and you can talk to them there, or you can phone them. Final part here, so is there any questions? We're going to give you about 5 minutes here, so if you have any questions, feel free to write them in the chat box. If you're on Facebook, feel free to write them in the comments, and then we can address them. So I'll just give you about 5 minutes. So it doesn't look like we have any questions. So if you do, feel free to write them and we'll still address them. But if you don't feel like writing them here, or if a question appears later tonight or tomorrow or later on, you can definitely reach out to me. I'm Samantha Rockburn. I'm the Degree Recruitment Officer here at Durham College. So you can send me an email through my email here at Samantha Rockburn or samantha.rockburn@durhamcollege.ca, or you can phone recruitment here at 905-721-3126. As well, you can always reach out to a recruitment officer at any point in time at recruitment@durhamcollege.ca. We are able to book an appointment, so you can come on campus if you want to come talk in person. We can talk over the phone, or if you want to do a tour, that's something else that we offer. So we do offer specifically degree tours. So if that's something you're interested in doing, if you want to come see the lab space for the Honors Bachelor of Healthcare Technology Management, talk to the program coordinator in person, Rick, we're definitely able to arrange that, and you're able to explore the campus a little and feel a bit more about what it's going to be like. We are still taking applicants for our inaugural first class that's coming up in September, so don't feel that it's past the deadline or anything. We are still taking people if you are interested in this program. Otherwise, that's it, and we can wrap up. We'll be hosting our third and final degree webinar in the summer series in August. The date will be coming out a little bit later, and I'll email everyone who's in this webinar right now, so you're able to join us then when we have another industry partner come join us and talk about their experiences within the healthcare technology management field. I want to thank everyone for joining us. I especially want to thank Iris and Rick for joining us and providing expertise and their wealth of knowledge about healthcare technology management, the careers that are in it, and all of the other experiences they've gathered. Otherwise, I believe that we are done now.